Welcome to the Neurology Rotation. We are the Brain Brigade, and we carpe irradium, that is, we seize the teaching moment, daily. We strive to insistently deliver excellent, safe, and thoughtful patient care as our standard of care.
The goals of the Neurology Rotation are A. To become more familiar and sharpen skills of neurologic clinical diagnosis, B. On the prudent, rational and responsible use of diagnostic tests, and C. The reliable, empathetic, diligent, intentional delivery of excellent clinical care.
Emphasis will be placed on the most common neurologic conditions. But the general approach format is of practical use to less common situations. Since you are going to encounter neurologic conditions throughout your clinical career, you will need to have solid understanding of the basic principles of clinical neurologic diagnosis and management. Help us and yourself get there.
You can obtain the printed version of the Neurology Rotation book. Also, there are a variety of additional resources created for you, including printed downloads, videos, and YouTube playlists. See in the QR codes in the book and in the description below. Please remember that the large digital library is available to you, too.
Physicians commonly encounter patients with neurological disorders. Essentially, all primary neurologic disease, for example, multiple sclerosis, Parkinson, etc., will develop medical complications. Virtually, most, if not all, medical conditions will develop neurologic complications. Neurologic disorders are very common, such stroke being the first cause of disability, and fifth leading cause of death. Also think of diabetic neuropathy, and migraines, for example. Or, seizures and syncope being some of the most common emergency on commercial airplanes. Neurologic conditions have a tendency to affect the quality of life of patients and families. Sometimes, these require palliative care and may lead to challenging ethical conundrums.
During the rotation, try to be more attentive to your own personal brand. A playlist is available for you to explore and develop the topic. Wear either a lab coat or a business jacket/blazer. Try to enhance your clinical presence, as it definitely powers your professional reliability and has therapeutic perception implications. You are exclusively in charge of that. Charisma can be defined as the combination of competence and personal warmth, both of which you can continuously develop.
You are expected to actively, diligently, and proactively participate in the care of the patients assigned to you. Proactive diligence, participation, relevant reading, knowledge sharing, and clinical responsibility are mandatory. Whenever possible, sit by the bedside to talk with the patients. The patients assigned to you are your patients and families to industriously take care of.
In the inpatient setting, as soon as patient is assigned to you, find your patient on iMobile, and assign yourself to the patient. In the morning, pre-round on the patients already on the service, and begin preparing the day's draft notes, prior to rounds. Attending round begin between 10 and 10:30 hours, on the neuro floor rounding room. Here, everybody presents and discusses their cases, and everybody gets to hear and cross-pollinate from all the cases on the service. The new patients will be presented in the standard, complete, yet succinct, method. Please, present your follow-up cases using the Super SOAP format. Participate in the discussions.
After table rounds, the team will go see the patients, where you will be leading the discussion with the patient and family in the room. You are their doctor. Before entering the room with the team, remind everyone, this is Mrs. So-and-so, with this symptom or diagnosis, her son Paul is in the room. When we are all in, then introduce the rest of the team, by saying something like, this is our attending Dr. So-and-so, and the rest of the neurology team. Show the team a key physical exam finding on every case.
You take care of the patients as if you are fulfilling the role of the consultant, of course under their supervision. Try to keep in mind the question to self, how would I handle this if I were alone? You are practicing for when your time to be alone arrives. It is imperative that you realize the limits of your own knowledge and experience, and be aware of too much overconfidence. Sometimes, a sincere "I don't know" is a perfectly good answer.
You have to know the details of each case assigned to you, including the patient and family expectations and goals, their living arrangements, name of close family members, name of their cat/dog, patient's home and current medications, code status, labs, test results, procedures, consultant's recommendations, etc. Nobody should know your patient better than you.
At intervals during the day, follow up with the patient, go check on them, and provide adjustments to the care as clinically indicated, check on response to treatment. Keep your senior resident and attending up to date. During the rest of the day, you keep the patient updated on the results of their tests, check on them, find out what questions they may have, and answer them. Consider calling their room to see how they are doing, and to provide updates. Above all, be personable, reliable, dependable, memorable, warm, and professional.
Provide the patient with printed and verbal education relevant to their health specifics. Don't wait for them to ask for it. You can find multiple sources of pertinent patient-level information, such as from UpToDate, Crams on Demand, and others.
Order tests and procedures in a manner that will be clinically and financially effective and efficient. Ask yourself the question, how will this test result change my management? Learn to know how, How long, and when to wait, you probably don't need to know it all right then and now. When taking care of the patient, some things can be given some time to allow them to declare themselves. After the test is resulted, then ask yourself again, was this test useful? Could I have done without it? Do I now need a new test to advance the diagnosis or management? What did I learn from ordering this test? Think medical testing stewardship.
Read daily, have your daily dose of reading, such as 2 articles, or a number of daily pages, or a daily chapter. Read about what your patient has, use the opportunity to expand your knowledge. Generate, write and keep 1 to 3 questions that may be amenable for research. Everything you learn will become useful, and will help scaffold more knowledge.
Our main means of communication is iMobile, that way we remain compliant. Contact your attending by text and/or iMobile and as needed.
In the outpatient setting, either neurology clinic or pediatric neurology, arrive at 8 a.m. These rotations could be 2 or 4 week long, and could be combined 2 week and 2 week, with inpatient experience, if your residency program allows it, and if you so desire, and if there is availability.
In the inpatient setting, arrive by 8 a.m. Start seeing your follow-ups, and the new patients that will get assigned. But, 1 resident per week will come in at 10 a.m., be there for table attending rounds and stay until later in the afternoon, such as 5 or 6 p.m. This resident will be assigned only new patients, and will sign them out to the AM crew for follow-up. He or she will staff each case with the attending on service.
Also, 1 resident per week will begin his or her work week on Wednesday and finish on Sunday, having off Monday and Tuesday. This decision, could be made by the group or by the program. Weekend work begins at 8 a.m., just like a typical workday. The on-residents will receive sign-outs from the residents that will be off.
On Fridays, sign out to the resident or attending covering for the weekend. On Mondays, get update from weekend resident or attending. When being off, or rotating out of neurology, sign out to the staying or incoming resident.
In your notes, please, always include the handedness of the patient, reason for consultation, the name of the consulting provider, and select the outpatient provider to get the report faxed to from the copy to section of the EMR.
There are some stroke scales or scores that are required to complete and to date and time within the first 6 hours of admission, which can be done in retrospect. All stroke patients must have the NIH stroke score, the Glasgow Coma score, and the modified Rankin scale done. All TIA patients needs to have the ABCD2 score. All ICH patients need to have the ICH score completed.
The progress notes assessment and plan is written chronologically. Do not edit the prior day's A and P, enter today's date, and begin a new A and P for today, and so successively. Always review the entire note, and update the physical exam findings, in every note.
You will probably be assigned to present a journal club article during the rotation. You could also take the initiative and select a pertinent and robust article yourself. There is a guide in Neurology Rotation book.
Fridays are feedback Fridays, both ways, be ready to give and to receive feedback. Every effort will be made to provide Friday feedback.
There is a large number of order sets already built in for many of the conditions we encounter. Get familiar with them, and include them in your favorites list. There are order sets that include the lumbar puncture order, and most common tests. If the patient is going to have a lumbar puncture, then hold anticoagulants, including DVT prevention anticoagulants.
Activate the delirium order set for all patients older than 65, and any with more than 2 acute or chronic medical problems, polypharmacy, history of delirium, prolonged hospitalizations, chronic institutionalization, etc.
When giving instructions about the systolic blood pressure needed on your patients, never say, for example, less than 140, or more than 120. Instead, say a range, such as 120 to 140, or 140 to 180. Use a range, create a corridor with boundaries on top and the bottom.
Also, we see patient with seizure-like spells. Do not use the word seizure, unless you know the episodes are seizures. If it is not clear what the episodes are, then call them spells, or seizure-like spells or episodes.
Thank you so much, and welcome to Neurology, to the Brain Brigade. We have been waiting for you for a long time.
Welcome to the Neurology Rotation. We are the Brain Brigade, and we carpe irradium, that is we seize the teaching moment, daily.